Hi, my name is Rebecca Ensor. I am a clinical coordinator and board-certified behavior analyst here at McMaster Children's Hospital Autism Program. Youth 12 to 17 years old are now eligible for your COVID-19 vaccines. And this includes all of the neurodiverse youth in our community. So what we've done is come up with a few tips and tricks just to help make the day a success for both you and your whole family. So first off, you know your youth best. Think back to the last time you've had a medical appointment. How did that go? Were there things that you could have done to set your youth or child up for success? Were there things that didn't go so well that maybe you would change? Think back to those times. They can really help you to prepare for your vaccine and anything associated with that. Would it help to talk to your youth and prepare them for what's going to happen when they go and get their vaccine? Perhaps it might be beneficial to practice sitting down, getting a needle, seeing the needle, waiting for that 15 minutes, answering some questions. Maybe not. Maybe it's more beneficial to just wait until the day. Maybe that anticipation is too much for your child. So think about that. You know them best. Perhaps it's also beneficial to remind them that this is the first of 2 shots. So it's not quite over after the first time. And again, maybe it's not beneficial to do that either. It all depends on your child. Is there paperwork that can be done ahead of time? Something like a consent form, depending on the age of your child. If so, get that done ahead of time if possible. And that might prevent some of that waiting time once you get there. What's the best time of the day to take your child for their vaccine, to book that? Perhaps they are calmer at a certain time of the day. Perhaps there's a low time in their day where it might be easier to insert that appointment. Where are you going to park? Plan that ahead of time. Have you been to that location before? How did that go? Do you have to go back there again? Perhaps it might be more beneficial to choose a neutral parking lot or someplace where you can walk to, so that they don't ever have to associate that parking lot with something in the future. Be prepared to wear a mask throughout the vaccine appointment, and prepare your child that they'll have to do that as well. They may have to change their mask into a medical one once they get to the door. Are they okay with that? Do you have to prepare them? But also just set them up for success. Make sure your child dresses in a t-shirt when they get up that morning. Make it easy for them to get their vaccine and not so much a struggle with a sweater or anything like that. Who's the best person to go with your youth when they go for the vaccine? Perhaps somebody that has a really good rapport, is able to calm them down when they're stressed. Make sure that they're prepared, that that person is going to go with them to their appointment as well. Pre-plan to have a relaxing day when you get home later that day, or perhaps the next day. Make sure that there's nothing big planned. They may be tired or experiencing other side effects from that vaccine the next day, or maybe that just was a big event for them and they may need to calm down. If you do have any medical questions or concerns about this vaccine and your neurodiverse youth, please just talk to your doctor. They'll have all of that information for you and can answer any of the questions that you might have. So what about during the appointment? Are there any tips that you should share with the clinician or the staff at the vaccine clinic when you go? Are there words that they should maybe avoid, or phrases that you may want them to say that might help your youth get through that experience? Would it be better to look away, or should you encourage your youth to look at the staff working at the clinic? Maybe there's a tablet or something that they can watch instead. Feel free to bring anything with you to the clinic that might make it a bit more successful. Are there calming items that they have? Something that they can fiddle with? Something to distract them? Anything that you can take to make that process go a bit more smoothly is fantastic, and you are more than welcome to do that. Just remember that these clinics are a safe space to bring your neurodiverse youth. The staff here are trained to work with everyone, and it's okay if your youth gets upset. That is no problem. After the vaccine, you are going to have to wait for 15 minutes after your child receives that vaccine, so that they can be monitored for any potential side effects that might come immediately. So what are you going to do during that time? Make sure that you bring something to occupy your youth. Is that a video to watch? Is it something to draw? Is it anything that they prefer? listening to music, anything like that. Continue to use clear and simple language during that time and just remind them how much time is left. Perhaps a timer might be useful. Once you're back home, continue providing support to your child. Perhaps they might just need an Advil to get over that injection site, or perhaps they're just feeling tired and they may just need to rest. That's okay. Fill that time with preferred activities. They did a great job and they got through that experience. We know that this can be a difficult experience for our neurodiverse youth and their families. So staff at the clinic are there to help. Please ask for anything that you might need and any support that we can give.